I think that the three areas where I would like to see President Obama and the Congress take action would be: number one, universal health care coverage for children; number two, strengthening pediatric research; and number three, building healthy communities. Reauthorizing SCHIP is an important first step. We need to have universal health coverage for children. All children in this country need to be able to have access to health care. And it really is, right now, the best of times and the worst of times. When I work at Packard, at the Children's Hospital, it is truly a place of miracles. There is amazing science going on and amazing discoveries being made. Extraordinary world-class care in terms of being able to address rare and life-threatening conditions for children. And then I drive 15 minutes over into East Palo Alto and see patients at the Ravenswood Family Health Center. Stanford pediatricians work out there. And juxtaposed to what I've seen in the Children's Hospital, I go to this clinic that is a community-based clinic where the children are not immunized because they haven't been able to get an appointment. We are overflowing, and the clinic is completely stretched to full capacity, and there are not enough providers. Coupled with the economic downturn, we really have had a powerful, storm come in terms of people losing their private employer-based insurance and needing to go onto the safety net, and the safety net, unfortunately, was already operating at capacity. So I feel like we exist between this amazing comparison of extraordinary, important medicine going on, and at the same time we're not able to meet the basic needs of a lot of children who are otherwise well. I think we need to continue to invest in pediatric research. I think that this is, in the big picture, a fledgling field, a newer field, where we're starting to see significant fruits of the investments that have been made. So I think protecting and continuing to invest in development of pediatric drugs and devices, making sure that everything that we have for children, which has typically only been, trials that have been done for medications are usually done on adults. And so making sure that we have all of the information that we need in terms of being able to use medications and new devices successfully in children. I think that the President and Congress need to invest in strong pediatric research. Finally, I think we need to think more broadly about children's health. And so thirdly, I would say that we need to ensure that every child in America lives in a neighborhood that is safe and walkable. We are dealing with an obesity epidemic whose roots come from the way we have designed our cities and the way we have designed our lives around the automobile and fast food and lots of different factors. And so I think we need to really think comprehensively about a neighborhood and a community where the child's health is one of the things we consider. So how we build things and design things need to take into account encouraging families to be more active and walk. The way we zone things need to take into account the density of fast food outlets, the way we market. I think we need to think about marketing to children differently than how we market to adults. So I think those are some things, and most importantly, the biggest change I think we need to make in the community would be universal preschool for children. I think that there is excellent data that the 0 to 5 years, the first 5 years that children have, are very important neurologically. The more and more research that is done has shown that children are developing very actively during those years with their brain development, and it is a window of time where if we can have them in an environment where they are having high quality preschool experiences, they can develop and be really ready to learn and do better in school. I think that with this kind of comprehensive, broad approach to child health, you can see that you could envision a place where children could really reach their full potential. And I think for America to be competitive, that's what we need to do. I know we have the ingenuity, I know we have the capacity, and it's really a question of political will. I think that we have a real opportunity right now. This new administration was elected in a different way than ever in the past. There was a grassroots movement between all of the funding and the communication and the viral information that went out. I think that the electorate is connected in a way that they never have been before. So even though I know it can sound trite, you know, democracy, you need to participate, I think that today it's really possible in a way that it hasn't been before. So I would hope that parents and other adult concerned citizens out there would understand that the investment in children is a good investment, and there are really easy ways to do that right now by going and joining an internet group. There are so many of them out there that make it easy to send letters, faxes, etc. to your legislators, letting them know, raising your voice. And I think a chorus of voices for children's issues could really make a difference.